We're joined now by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19. And you just heard that story. I know you're not surprised by that. There is that study claiming the virus could be eradicated if 70% of people or more consistently wore masks. So I think it says, what are your thoughts on that? I think we know your thoughts on that because we've consistently been talking to you week after week from the beginning of this pandemic. And then let's quickly talk about what type of mask is better. Is there one better than the other?
So again, one of the things, Maria, is that we don't know exactly how much immunity is needed to achieve that herd immunity where you're going to stop the virus in its tracks. If 70% of people wore their mask in public and it's 70% effective, you have potentially about a 50% reduction in virus. That could be enough. But remember, wearing the mask in public is not enough because we know a lot of the virus is spreading in our households, okay? As far as which type of mask, the more layers, the better. So the 3-layer masks like this that has an outer fluid resistant layer, an inner cotton layer, and then a middle layer that has this what's called polypropylene, which can have some electrostatic charges that can actually trap viral particles. That's better than the cloth masks.
And how you wear it, right?
And cover the nose, right?
Got to cover the nose and the mouth. Yes.
It's not a chin strap. It's a mask. Okay. The University of Washington.
Thank
you.
The University of Washington COVID projection model shows the U.S. is not flattening the new infection curve until mid to late December or even into mid-January. Here in Massachusetts, the model projects days with the possibility of 8,000 new cases over the next few weeks. Obviously, we're going into the holidays. So do we have the testing and the hospital capacity to handle numbers if indeed that happens?
So just a reminder, these are models, and models are only as good as their input. So no model is perfect. But let me just say that right now we have around 900 plus patients hospitalized, okay? Back in the spring, our peak was at 4,000. So we have plenty of capacity right now. But we certainly don't want to go to a place where we have 8,000 cases a day, for example, or 8,000 cases over a few days. That would be very concerning, since generally about 20% of patients are hospitalized when, of those who test positive. So the answer is, Massachusetts has been doing a great job, but we still need to, we have around 2,000 cases a day. We need to drop that number. We need to flatten that curve.
Federal health officials are saying that vaccine distribution could begin mid-December. We're hearing December 11th, I believe. We know that there are some manufacturers out there that are warning that if you get it, you may get sick after getting it. So let's talk more about that. And if someone even makes the cut for the vaccine, should they plan to take a couple of sick days once they get the vaccine? And how bad are the side effects?
So this is so exciting. We have 2 vaccines that have close to 95% effectiveness. We've never seen that with a respiratory virus like COVID-19. We compare it to the flu, which obviously the effectiveness is less. So it's true that with all vaccines, there are side effects. And there are side effects with this vaccine: pain at the injection site, maybe some swelling, fevers, aches. But we think that this is similar to potentially the shingles vaccine. After the second dose of the vaccine, there's supposed to be more side effects, but most side effects are mild to moderate. And guess what? We want some of those side effects because it means our immune system is revving up to fight that virus. Might some people have to take a day off the day after the second dose of the vaccine? It's possible, though most people won't.
Got it. Doc, quickly, because this is the last time we're going to see you before Thanksgiving. Thanksgiving is Thursday. We know that some people are not following CDC and your expert medical advice to stay home and keep the bubble tight. Any last words of advice, warnings, last words before people do what they're going to do?
Okay, a few things. Testing is very important, but a negative test is not definitive. As we just heard, you can have a negative test and still have COVID-19 when you're sitting around the dinner table. Keep the masks on as much as possible, except for when you're eating and drinking. Please space those tables out. Don't just have one table. We're used to being as close as possible in Thanksgiving. Hopefully that will happen next year. This year, space the tables out, open the windows, keep the masks on, and, be safe. Wish everyone the best. Wish you guys a happy Thanksgiving. You're awesome to work with.
Oh, we feel the same way about you. Be well, Dr. Todd Ellerin from South Shore Health. Happy Thanksgiving to you and yours.
Happy Thanksgiving, Doc. Thanks for everything.